Your postoperative pain will be managed with oral pain medications as well as ice therapy. You typically will have pain for 7 to 14 days after the procedure, and then it goes away significantly beyond that. To help reduce swelling after surgery, I recommend you place an ice pack on top of your underwear 30 minutes on, 30 minutes off while you're awake for several days after the surgical procedure. You should also continue to wear your scrotal support for compression of the area. You will have a sterile bandage over the incision site. This bandage can be removed 2 days after the surgical procedure. Under the bandage, you'll see several steri strips, which are like little band-aids, which will peel off on their own in approximately 1 week after the procedure. After the surgical procedure, once you're comfortable, we recommend you start pulling down on the pump in the scrotum. This is typically done approximately 10 to 14 days after the surgery if the pain is under control. One of the side effects of taking pain medication is constipation. I recommend that you take daily Colaze while you're on the pain medication to help prevent the constipation that could possibly occur. 24 hours after surgery, you may shower. However, you're not allowed to have any bathing in a bathtub during the post-op period. We recommend you lift no more than 15 pounds for the first 2 weeks after the surgical procedure. You can drive a car as long as you're no longer taking the narcotics, and most patients can return to work 2 weeks after the procedure. The recovery time for an inflatable penile prosthesis is approximately 10 to 14 days. However, before you can use the device for sexual activity is typically 6 to 8 weeks. After the surgery, you may notice some bruising in the scrotal area, which is completely normal. You should call us though if you notice significant swelling, as if the scrotum were the size of a grapefruit, or you noticed some redness or had any fevers post-operatively. We will see you in the office 2 weeks after the surgery for your first post-operative checkup. You will start cycling a device as early as 2 weeks after the surgery. You can start using the device for sexual activity as early as 4 weeks if you're comfortable using the implant. If you have any questions during your post-operative period, you can call my office during business hours, or if you have any emergency questions, you can call after hours, and there's always a physician available on call. You also have access to the patient advocate who is available 24 hours a day.